sometimes we make a lot of mistakes in diagnosing adenomyosis and we get a lot of confusions. So here are some quick tips and tricks through which we can diagnose adenomyosis from Dr. A.B. Vani, CEO of Bilmed. And sir, please.
Thank you very much, ma'am. So today we will discuss some quick pointers to diagnose adenomyosis sonographically. In our previous sessions, we talked about the endometrioma. If you have not seen that session, please go to that session because that will be, adding some important points regarding the adenomyosis also. Because what adenomyosis actually is, adenomyosis is nothing but an ectopically implanted endometrium, where now it is not in ovary like it was in the endometrioma, but it is now in the uterus. When I say uterus, it is actually in the muscles of the uterus, in the walls of the uterus. Both are connected. When I say both means that ectopically implanted endometrium as well as the endometrium, they are hormonally connected. Because they are hormonally connected, both will grow. But what about this ectopically implanted in the muscles? This will also grow, which means that patient first of all will have pain, and that too cyclic pain. So number one, you have to correlate clinically. Number one, before ultrasound. If patient is having an intermenstrual bleeding, spotting I will say, not bleeding, spotting, and the pain which is cyclic, that is, going in favor of nothing but the adenomyosis, then you have to put a probe to see what? To see a patch over there. Now, when I say patch can be anywhere. Patch can be anywhere in the uterus. But the question is, will there be only one patch or multiple? Multiple patches. So usually, I use the word usually adenomyosis will have multiple patches, not only one, because sometimes we have to differentiate it from a fibroid. Fibroids are usually solitary, but if there are multiple, then it is going in favor of adenomyosis. But why not to scan an ovary? If there is a patch in the ovary, that will be a chocolate cyst. So chocolate cyst in association with a patch in the uterus is going in favor of adenomyosis, not in favor of fibroid.
Okay.
So these are some quick pointers regarding the adenomyosis. But lastly, I will end with the very important pointer, and that is the size. Size matter here. Size does not mean that if I am having this much of size. No. The abrupt increase in the size or decrease in the size is going in favor of adenomyosis. So if you have diagnosis or somebody has diagnosis a 30 millimeters patch with a query fibroid or a query adenomyosis, but today you are scanning, you are not getting. Today I mean that after some time, maybe 4 days, 5 days, 10 days, you are, you have got a diagnosis of 30 millimeters. Today it is not 30, it is 10 or it is 50. So the abrupt change in the size, I will say, it can increase, it can decrease. That is going in favor of adenomyosis. And books are writing that I am having an, discrepancy in anterior to posterior wall. Why so? Because I just now told you that we will be having multiple small patches, and these multiple small patches are usually in the posterior wall, making it to look thicker than the anterior wall. So if your posterior wall of the uterus is looking more than the anterior, that is also going in favor of. And usually these small microscopic patches, multiple patches, are at the interface of this endo and the myo junction. So that way I will be having a loss of endo-myo junction. So these are some quick pointers for diagnosis of this adenomyosis.
Very useful tips to diagnose adenomyosis, and we can do it very easily now. Thank you, sir.
Thank you.